welcome to everyone to join our webinar this morning. I'm going to spend some time talking to you about some research which we commissioned in Leeds about housing options, information and advice. I'll talk to you about how we developed recommendations that you'll see in the report and the housing information and advice design principles we've compiled as a result. And we're hoping that this will be a useful piece of work and conversation this morning for local authorities, for housing providers, from charities, for policy people. So we're hoping it'll be a useful discussion all round. So just to start, the Centre for Ageing Better, if people don't know us, we're a charitable foundation who want to create a society in which everyone enjoys a good later life. And a key goal within that is that more people are able to live in safe and accessible homes. So we hope to do that by encouraging improvements in conditions and accessibility of existing housing, increasing the diversity of suitable homes for people approaching later life. And more importantly, for this piece of work, the Centre is really keen to make information and that we can influence making information and advice more easily available to help people approaching later life make good house choices. So as Ellie described, we Centre for Ageing Better, we have a partnership in Leeds which I support, and our partnerships with Leeds City Council and Leeds Older People's Forum. Now that partnership started in October 2017. However, before that, Leeds were really keen to understand from older people what was important to them about their housing, and went out to consultation in 2016. And one of the things that older people told the group was that they want to know what their options are and where to go for information and advice. So when the partnership started, the Centre for Ageing Better thought, we can really help with our partnership to help to start to unpick some of that statement, because we know that housing options, information, advice can mean a whole range of things. It could be from tenants' rights to equity release. So what we did was we commissioned some primary research from an organisation called Aligned Consultancy, who went out and spoke to older people about want to access it and then what's actually available. So we thought that if we could look at those two things, then we could start to see what gap there was between them about what's needed and what's available, and make recommendations for improvement. At the same time, the researchers also spoke to national and local providers of information and advice. So they spoke to professionals as well. And I just wanted to really set this piece of work in some kind of context. So actually, more than 90% of older people live in mainstream housing. And what we mean by that is that they're not living in sheltered or care homes or retirement homes. It's general housing that older people are living in. And actually 80% of the homes that we need by 2050 are already built. The number of older people living in a mainstream housing, it's a bit less in Leeds, but generally what we heard when we were speaking to older people was that they want advice to stay in those homes or within the community where they have those social support networks available. And just to add to that context, when we're talking about housing information and options information and advice, we are thinking about a whole range of information and advice, either from say support and personal care, home to hospital, that kind of information and advice, to people who need to help if they're facing eviction. So it's the whole range. So if I move on to what we found when we spoke to people about when and how people access information and advice about their housing options, the research is to really try and understand what motivates people to look for information and advice. They asked them, what does good housing actually mean to you in relation to getting older? And it's what you'd expect, actually. The main priorities that people referred to are quite basic needs in terms of it being affordable. People want to live in warm, dry, energy efficient properties that are well maintained, and they want to be able to, they want to be independent both financially and practically. They want to be able to look after their homes. So regardless of tenure, when people were looking ahead, they wanted to remain living as independently as possible. But even if that meant moving home or adapting the current home to allow them to do so. So when do people seek housing information and advice? We found that actually people don't proactively plan, and they gave us a number of reasons for that. And fear of the unknown. People are happy living where they are. They're living in their neighbourhood, and they'll put up with quite a lot to stay there actually, because people were saying they feared the poor quality alternatives, and people, as you imagine, particularly fear living in care homes. We also found that the cost of moving was felt to be prohibitive. People didn't feel that they could actually afford financially to move, and those that were more affluent weren't sure what they were going to gain by moving or downsizing, and there was a perceived lack of options for people to move into. So people couldn't necessarily afford retirement villages, and as we know, there are the number of bungalows and smaller houses available can be few. So for all those reasons around the fact that people don't really plan for their future, and tend to seek advice at trigger points such as divorce, loss of partner, health issues. They're making decisions at crisis when they maybe don't have the emotional, physical wherewithal to deal with them. We felt that it was really important to make housing part of all wellbeing conversations. So what do we mean by that? So, well, really it's about any professional that we come into contact with, any family or friend. Really, if you're starting to talk to people about their well-being and how they're coping in life and how making plans for the future, it's not just about your health and your NHS health checks, it's about your home and making people think about that. So these are our recommendations to try and move that along, which is to use targeted training in the community so that professionals that people do come into contact with have got some training that they can start to put housing into those conversations. So in Leeds, we have better conversations training for professionals, and now that will sort of broach the topic of housing. And we know that organisations don't want people to be making their decisions in crisis. We want to move from that to prevention. So it could be about starting to make a mini assessment for professionals to use to help people to think about how they may prevent those crises occurring in later life. And so we want to have targeted training to include housing in conversations. We want to support professionals to help people assess their housing needs, and then train people into how to use that assessment. So how do people seek housing options, information and advice? People do have different entry points, and what we found was that with owner-occupiers, they weren't really sure what they were eligible for. They weren't sure that they could approach the local authority for information and advice, and they were far more likely to search on the internet for information and actually find that quite overwhelming and not be certain of the quality of information that they were actually getting. Private larger well-known charities, and social renters were more likely to approach their landlord, and on occasions they would approach their local councillor. There was also some uncertainty in amongst people about what local authorities offered, because the old people that we talked to within the focus groups and in the one-to-one conversations thought that community hubs and libraries were a good place to offer information and advice, and we weren't clear whether they understood that those community hubs were actually run by the council in Leeds. And actually one of the interesting things that came up was that people don't always want to approach charities that they feel are for older people because people don't think that they're that old. So the recommendations that we've come up with, given that people do go to the internet as the first port of call, if there's the opportunity to have a directory of up-to-date, low-level generic information, then that's a recommendation. We know that budgets are short for leaflets these days. Leeds offers a directory of information that people can actually save the pages that they search and print them off as a PDF, which we saw as good practice. I think it's about raising awareness about what is available. There was quite a sense from the people that we talked to that they weren't really sure what was available for them in terms of housing options information and advice. And it's about testing those campaigns with people to ensure that messages are correct for them and that we're not, they're not put off because they think, oh, that's just for older people and I'm not old. It's about how we age better and age well. Obviously, writing materials in a customer focused way so that they're approachable. So what do people value in housing options information and advice? And I think that's probably because people want to stay in their own homes, want to stay in their own community, so they value what local people know about that, their communities, and I think because of that there was an appetite from the people that we spoke to get information from volunteers, particularly if those volunteers are their peers. So I think that does kind of beg a question for organisations in that, how can they support volunteers to be included in their information and advice services whilst understanding that some advice does need to come from qualified professionals. People said that they would trust services that got back to them when they said they would. People get tired of being passed from share the story again and again, so they want it needs to be well coordinated, and as a result people were happy to share their information and their data between. And I think another thing that was interesting about this piece of research when we talked to some of the providers and the professionals was that people may approach an organisation but they don't actually realise what their issue is, and it can take quite a bit of unpicking to get to what's going to be helpful. And a well-targeted campaign to ensure people know where to go. Like I said earlier, people don't necessarily see themselves as old, and that people valued the skill sets that they came across in charities and the approachability of local organisations, professional approach and qualified approach as well. And I think that partnership approach is one that we're trying to take in Leeds. I think if you've looked at the appendix within the Home Truths report, hopefully you'll centre has helped take it forward, and then as a group, the Me and My Home group, which comprises of representatives from Leeds City Council, Leeds Older People's Forum, Care and Repair Leeds, looking at we've developed a set of recommendations together, and we're going to take those forward in a culture of improvement and partnership working. So that's all I wanted to say about the research. So I've put my contact details up there, which I'll leave on screen. I don't think you can see my full Leeds number there for some reason, but I'm happy to take questions now, or if people can't think of questions now, then please do get in touch with me in the future. So I've got a question that's come through. Let me just get onto my question screen. So question from Wendy at Care and Repair England. Thanks, Wendy. Thank you for this report. It reflects a lot of the experiences of older people I've met over the years who are increasingly trying to plan ahead for later life, but not sure where to turn. You mentioned the need for trust in the person providing the information, as local authorities are centralising many services in an effort to cut costs. As you say, many homeowners do not think they can use council services or are able to access social housing. Do you think there's a case for national information and advice sourced specifically around housing? So I think that's a really important question, Wendy, and I do think that there is a case for national information and advice. The All Parliamentary Party Group did call for that. I'm sure I'm not correct in saying that. And in the Home Truths report, one of the recommendations that we do make is a call for a national information and advice service that local areas could call upon. So I would sit behind that call, most definitely. I don't know if there's anybody else can within the chat sort of add their views to that. So I don't know if there's another question coming through. Let me just have a look. So I think another question that we've had is which, as a local authority, which would you say is the where would you start? What's the first place that you would start? And I think you know, I'd really recommend taking the approach that they have in Leeds and start with talking to the older people and consulting with older people about, you know, what is important for their housing and options in preparing for their housing in later life. And when Leeds did speak to a group of older people, went out to consultation, it was housing information and advice came out very clearly, alongside, you know, the need for specialist housing, the need for support to remain independently, which again came through very clearly in the research that we had. And also having their voice heard when any new developments are coming in place. So those are the four things that Leeds heard. And I think it's about talking to older people to understand what that actually means. So going back out to them, as we did within the research that we commissioned from Aligned, and it was a qualitative piece of research. We spoke to 58 older people, both in focus groups and in one-to-one interviews, and we spoke to people across tenure. So another question coming through from Carol, who's from Leeds, and she said she'd like to thank Centre for Ageing Better and Aligned Consultancy for this piece of work, because it supports the ambition for Leeds to be the best city to grow old in. I think that's actually it's an interesting point to raise, actually, about how the age-friendly work in Leeds is structured, in that, you know, we do take a person-centred approach to working together to enable. Leeds is very ambitious in it wants Leeds to be the best city to grow old in. We have leaders on each of the domains in age friendly. So we've got housing, transport, being active, included and respected, the whole range. And we've got political support from our portfolio holder for adults and health. So it's not just virtually as well. There is, what we need is we've took it to the Me and My Home group, and we will develop an action plan, and we will actually start to put some of these recommendations in place. I don't know if anybody could tell me how they're so what actions, that's a good question, what actions will be taken by Leeds following this report? We've just started to look at how we can develop that kind of mini planning tool that, we discussed that, we don't plan ahead. I'm approaching I'm approaching later life and not thinking about moving house. So it's kind of how do we make those how do we start those conversations? So the first thing that we're going to do is work with our local providers and find out what resources they use. So I met with Age UK Leeds yesterday. They've got a later life goals initiative. I've got resources from Care and Repair Leeds. So I will put the search out wider. So we're going to look at what everybody does and how we can bring that together into a tool that we can hopefully develop digitally and have a digital platform that we can then use to support training of staff and professionals that come into contact with older people. What resources would councils need to start this process is another question. I mean, I think it will take a time resource. So we're doing it as a partnership approach. I've mentioned the Me and My Home group, and that's a group of, I would say, about 10 committed individuals who come to sort of regular two monthly meetings to actually drive this forward, to look at what actions we need to take, and then each of us sharing that responsibility to move this forward. So we are trying to do this on not a lot of additional financial resource. It is about working in partnership and trying to do it together so that we can each bring our expertise to the table. Yeah, I hope that answers those questions. I don't know if anybody can put within the chat any good practice that's happening in their localities or within their providers. So I'm told there's a question in the Q&A box, sorry. I am a CIC in Devon trying to provide housing options from older people, and I'm having great difficulty getting funding as we have fallen through the gap between. What is your opinion on this? Thanks for that question, Carol. I think there's great evidence, isn't? I hope you've got evidence. People's health. We've done reviews in terms of, the spending small amounts of money on adaptations and how that can impact on, spend on health going forward. And so we've got our adaptations report. You could have a look at that in terms of evidence, and that would be, I think, the angle that I would try and work on, is how we can spend sort of small amounts of money up front in a preventative way to stop that spend that the health system has to make going forward. We know that sort of poor quality homes or houses in disrepair can impact on people's falls, and a huge amount of money is spent on that. So that would be my recommendation in terms of trying to help put that case together. I've got another one here. London Building Society has secured private funding to refurb homes of homeowners aged 55 or over, and they're also using a person-centred approach. Would you like to get in touch with them to improve the homes of elderly in Leeds? That's a great offer actually from London Rebuilding Society. We'll definitely get in touch with you after this webinar to find out how you've secured that funding. That we'll pass on that information to Carol if that's available, Carol in Devon, and definitely like to hear a bit more about that and share that with people on this webinar if that's a possibility. Okay, another question coming through. Okay, I may have been mistaken there. I can't see a new question coming through. So, I mean, I hope people have found that helpful. I think, you know, what's happened in Leeds is we started with the old person, looked at what's available, look at the gaps, look at how we can fill those gaps, not necessarily by creating new services, but working with the services that are already there and helping them develop their offer. We've heard from colleagues out there who are, you know, really see the value in housing and the impact that we know that it can have on people's health and social care needs in the future, and how we want to help people plan and not make decisions at crisis. So I'd really thank you for all the really pertinent questions and for joining us on the webinar. And please do keep in touch and sharing good practice, and let's keep talking to each other. Oh, one last question actually. A number of local authorities in Greater Manchester have employed housing options for older people workers who work closely with individuals trying to make the best decisions about their housing options. Some are hospital based, so working with hospital discharge teams, and others are working more closely with community groups and those who might be able to refer people. Unfortunately, like the CIC in Devon, funding is not always secure. Some, if funded by housing providers, with some funding from health, but nothing secure. I think Wendy raises a really good point there about actually trying to give information and advice in a hospital base, and I've heard that not only great that that's happening in 6 out of 10 of the local authorities in Greater Manchester. I've heard of an initiative in Sheffield where the Citizens Advice Bureau is working out of hospital to give information and advice to people, not necessarily older people, but yeah, helping people when they are at that point of crisis, which, you know, whilst we want to prevent it, it still is happening, and so people still do need that support at that time. I think this funding question does seem to be one, funding housing does seem to be one that people are all struggling with, so that may need to be our rallying cry at the end of this webinar. Yeah, also spoke to colleagues in a local Age UK recently who were looking at setting up a hub within a hospital to give people information and advice about a whole range of things, but definitely housing. So it does sound as if there's some great work going on out there, and it will be good to keep this network and this sharing going after today. So somebody has shared a video with us to take a look at. I don't want to click on that now because I'm not sure what that means. I'll do to the whole of the webinar. So what we'll do, we'll take a look at that offline and and share it around the attendees, if that's possible. My technical people in the background. Is there anybody? I think I've answered the questions that have, okay. So that would be great. All right, well, thanks everybody for their time. And I think we're coming to a close, and just want to say, thanks very much for your time. Please take a look at the report, sign up to the Centre for Aging Better's research and newsletters, and let's keep sharing good practice. Thank you.